How to complete the subjective assignment. When we are doing the subjective assignment, remember this is what the client says. Subjective, they say it. So you are not documenting any of your observations. You are only documenting what the client says. So first of all, why are they seeking care? Is it just for a physical examination? Are they having problems with, let's say, an upset stomach, or they've had a headache that won't go away, etc.? Do they have any military history? If they say no, you can document no. If they say no, you can also document non-applicable or N/A. What is the history of their present illness, including the symptoms? In other words, what's going on with them, and what types of symptoms are they having? If they have a headache, let's say, okay, it's only in the right side, it's right above the right eye, kind of in that temple area above the eye, or for example, maybe they've had nausea, vomiting. I've only vomited 3 times today. It's been undigested food, etc. So determine what the presenting symptoms are. What medications are they currently on? And it's very important to not only determine what um, prescription medications they're taking, it's also important for them to understand that we need to know what supplements they're taking. Are they taking any vitamins? Are they taking any over-the-counter medications? All of these things can affect the client's other medications they may be taking, so they can interact with one another. So it's important to know what these supplements, what the over-the-counter medications are. They don't always tell you that. So, you ask what medications, this is what you expect, but they don't always understand that this is what they want you to, or they, that you want them to be providing. Do they have allergies? Is it allergies to medications, allergies to foods, seasonal allergies? Are there, for example, allergies to different substances, etc.? Are they up to date on their immunizations? Now, if it's a child, we may want specific immunizations, but as an older adult or an adult, we might want to know, are they current on flu vaccines? Are they current on COVID vaccines? Have they had pneumonia vaccines? What is their past medical history? Specific illnesses they had as a childhood, such as measles or chicken pox, etc. What particular adult illnesses may they have had? Have they been hospitalized or had any surgeries? Or do they have any mental health issues? What is their family history, medical history? So, do they have a grandfather who had heart disease, a grandmother who was diabetic, or a father who has renal failure, a sibling who has hypertension, etc., etc.? How many years of education have they had? So, we can say +1 post-secondary. Secondary is high school. That would be college, 1 year of college, or do they have a bachelor's degree, an associate's degree, etc.? What type of occupation do they do? Their housing. We don't necessarily want to know where they live, but we want to determine, do they live in a safe environment? Do they live somewhere where it is, um, I mean, do they have adequate housing, or do they have, let's say, um, do they have some particular housing need? We do have a lot of homeless people in this area, so very important for us to determine what their housing is, and is there any particular environment that may be an issue. We move on to finances, and I'm not asking how much money they make per hour or per year, etc., how much they bring home per paycheck. Basically, we're needing to know, are there any financial needs, or are they financially secure? Are they still being supported by their parents? What type of exercise do they do? Do they exercise regularly where they are, let's say, exercising every other day? They're walking for 3 miles, or they are swimming 20 laps, etc. We need to know how frequently they're exercising and what type of exercise they do. Do they just lift weights? Do they do cardiopulmonary exercise where they are riding a bicycle, etc.? How many hours of the day or night do they normally sleep? And do they feel rested once they awaken? Do they use tobacco products? And this is uh, or it is also the smokeless tobacco. And not only do they currently use tobacco products, have they ever used tobacco products? And it could also be important to know, are they exposed to secondhand smoke routinely? How do they cope with stress? Is there a particular activity that helps them cope with stress? Or is there particular things that help them cope with the stresses of daily life, such as maybe watching television or reading a book, listening to music, or taking a walk, etc.? Are they exposed to domestic violence? Do they abuse any substances? And we do know that substance abuse is not limited to medications. It can be things like paint fumes or aerosol, etc. As far as sexuality, we're not looking to determine if a client is sexually active. We are wanting to know, what gender do they identify with? As far as functional assessment, do they have any issues with completing their activities of daily living? In other words, are they able to feed themselves? Are they able to cook for themselves? Are they able to dress themselves, brush your teeth, brush their hair, clean their house, etc.? As far as cultural assessment, are there any particular cultural beliefs that they observe that would affect the way that we take care of them? Let's say, for example, we're talking about the culture of Jehovah's Witnesses, which is a religious denomination. They do not believe in blood transfusions. So that would be a cultural assessment that would affect the way we would be able to take care of that particular person. And spiritual assessment. Again, we're not necessarily wanting to know how many times a week do you go to church. We're basically wanting to know, do you identify with any particular religion or anything else that is involved with spiritualism? Then we move on to the assessment of the systems. Do you have any issues with your skin? Do you have any issues with your hair, with your nails, with your head, etc., etc.? We move on down to peripheral vascular. They may not know that that is going to be, do you have issues with numbness or tingling in your legs or your hands? Um, do you have good feeling? Do you have a loss of sensation? As far as musculoskeletal, this would be something like arthritis or any type of musculoskeletal issue that would prevent them from performing those activities of daily living. As far as neurological, do you have any history of depression or mental illness, anything that may affect their ability to cope with different situations? When we're talking about obstetrical or sorry, I keep skipping. How about women's health? When we are looking at women's health, we're looking at gynecological, so anything with their reproductive organs or their breasts. These could have specific implications when it comes to figuring out what might be going on with a client. If it is a woman who has reached menarche, menarche is the very first menstrual period. We need to know when that started. We need to know, for example, when the last menstrual period was. We need to know how long is your cycle. And, is it 28 days? Is it 30 days? How many days does menstruation normally last? 5 days, 7 days, etc. These are important things that can help us figure out what might be going on with a woman. As far as obstetrical history, have they ever been pregnant? And if they've been pregnant, have you ever had any live births or any abortions or preterm births? How many term births? Men's health, any issues with prostate, with testicular cancer, etc. Any issues getting the urinary stream started, or maybe getting that stream, or what is the force of that stream? With urination, do you have any issues urinating, such as pain? Are you going frequently? Any odor to the urine? Does it burn, or do you have any pain with urination? All of that can be important information. And again, mental health, very similar to neurological, needing to know about the depression. Do they have a history of mental illness? Neurological, we may want to consider some things like spina bifida history or Down syndrome, where they have some of those mental issues. So those can be a little difficult to separate. Let me know if you have any questions.